Hello, my name is Demuria, and I'll be presenting about monkeypox. What is monkeypox? Monkeypox is a viral illness and it's caused by monkeypox virus. It is an enveloped double-stranded DNA virus of the orthopoxvirus genus in the Poxviridae family, which includes variola, cowpox, Yersinia, and other viruses. There are two distinct clades of the virus. Clade 1 that has the subclades 1A and 1B, and Clade 2 with subclades 2A and 2B. The global outbreak of monkeypox in 2022 and 2023 was caused by the Clade 2B strain. Although the global outbreak was the most severe in 2022 and 2023, the outbreak is not over and is still continuing to affect people on a daily basis. We have also seen outbreaks of clades 1A and 1B in the Democratic Republic of Congo, as well as other countries in Africa. Lately, as of August of this year, cases outside of Africa have been detected for clade 1B. Signs and symptoms. The signs and symptoms of Mpox are usually starting to appear within a week, but it is possible that it may start showing signs within 1 or 21 days after the exposure. Most of the time, the symptoms typically last 2 to 4 weeks, but those that have weakened immune system may have the symptoms longer. The symptoms most commonly include rash, fever, sore throat, headaches, muscle aches, back pain, low energy, and swollen lymph nodes. Some patients see a rash as their first symptom, which makes it a bit easier for them to identify that they've been infected with monkeypox. However, in some cases, the first symptoms have been fever, muscle aches, or even just a sore throat. Continuing the signs and symptoms of monkeypox. As you already might know, rashes and lesions are expected with Mpox. Some people may have as little as 1 lesion on their skin, and others may have hundreds or even more. The lesions can appear on palms of the hands, soles of the feet, face, mouth, and throat, groin, and genital areas, as well as the anus. Most frequently, the lesions start to appear on the face first and eventually spread to the rest of the body. It is also possible that the first lesion might appear on the area of the body where contact was made, such as genitals. The lesions start out as flat sores and later develop into blisters filled with liquid. They might be itchy and painful. Over time, as the rash heals and the lesions dry up, they crust over and fall off. The causative agent. Mpox, which is formerly known as monkeypox, is a disease caused by infection with the virus, known as monkeypox virus. It is an enveloped double-stranded DNA virus of the orthopoxvirus genus in the Poxviridae family, which includes variola, cowpox, Yersinia, and other viruses. This virus is part of the same family as the virus that causes smallpox. People with Mpox often get a rash along with other symptoms. The rash will go through several stages, including scabs, before healing. Mpox is not related to chickenpox. Mpox is a zoonotic disease, meaning it can be spread between animals and people. It's endemic or found regularly in parts of Central and West Africa. The virus that causes Mpox has been found in small rodents, monkeys, and other mammals that live in these areas. Pathogenesis. Transmission. Mpox can be transmitted through direct contact with infected animals, close contact between animals and humans, or human-to-human transmission. Mpox enters the body through the oropharynx, nasopharynx, or intradermally. Mpox replicates at the entry site and in the local lymph nodes. Mpox spreads to other organs, like liver and spleen, through primary viremia. Mpox spreads to the cutaneous parts of the body through secondary viremia, causing mucosal and other lesions. After the pustular phase, a crust forms in 7 to 14 days. And lastly, patients are no longer infectious once the crusts fall off. After the entry into the body, the virus replicates at the inoculation site and in the local lymph nodes. Primary viremia leads the viral spread towards other organs, like the liver and spleen. And it also replicates. Early clinical features start at this stage. When the secondary viremia takes place and the virus is transferred towards the cutaneous parts of the body, then mucosal and other lesions develop. The molecular diagnosis is possible from the stage of primary viremia until the pustule formation. The antibody IgM can be detected when the secondary viremia starts till the lesions are resolved, whereas the IgG can be detected from the 3rd week of infection till a year, depending on the patient's immune status. Viral shedding can happen within the beginning of the clinical symptoms. However, the risk of period of viral shedding is vesicular and pustular stages. It has been demonstrated that orthopox viruses can disturb the pattern recognition receptors expressed by the innate immune cells. These proteins consist of several subfamilies, including the toll-like receptors, NOD-like receptors, RIG-1 receptors, and C-type lectin receptors. They're responsible for recognizing various microbe-related molecules or molecules released by impaired cells. Once the PRRs bind to the microbial ligands, the subsequent cascades occur, including activation of inflammation-related transcription factors such as nuclear factor kappa B, interferon regulatory factors, and activating protein 1. It has been known that signal transduction of TLRs involves several types of intracellular adapter proteins such as MYD88, MAL, TRAM, TRIF, and SARM, which are pivotal for triggering intracellular immunologic reactions. Any disruption in those adapters proteins may cause problems in exerting adequate immunologic responses towards viral infections. At this point, orthopox viruses contain genes encoding proteins that could interact and damage the functionalities of those adapter proteins. For example, MPXV could produce a protein called A47R, which can interact with MYD88, TRIF, and TRAM. Consequently, these adapter proteins' physiological functions are disturbed, following by the inhibition of the transcription factors associated with inflammation. Ultimately, this condition leads to the failure of the innate immune systems to recognize the viruses. Studies indicate that West African and Congo Basin isolates of monkeypox virus are genetically distinct. The Congo Basin is more virulent, and monkeys are compared to presumed West African. This finding may explain the lack of case fatalities in the U.S. 2003 monkeypox outbreak, which was caused by a West African virus. Virulence difference between West African and Congo Basin are further supported by epidemiological analysis that observed a similar prevalence of antibodies in non-vaccinated humans in both regions. While more than 90% of reported cases occurred in the Congo Basin, and no fatal cases were observed outside of this region. However, the 2022 outbreak shows signs of separation from the original 2 clades, particularly in the transmission efficiency between humans. This subclade branched from clade 2 and is currently noted as clade 3 or human monkeypox virus. In 2022, Mpox was driven by human-to-human transmission outside of Africa. It is not yet known whether the latter is due to solely to behavioral and environmental factors, or whether Mpox virus is adapting to a new host. Genome sequencing has revealed differences between the current outbreak strains classified as clade 2B and the prior clade 2A and clade 1 viruses, but whether these differences contribute to virulence transmission has not yet been determined either. Transmission. Person-to-person close contact can include skin-to-skin contact, mouth-to-mouth contact, mouth-to-skin contact, or prolonged face-to-face contact. It can also include contact with objects like bedding, towels, or electronics that have been touched by someone with Mpox. Animal to human. Humans can get Mpox from wild animals such as squirrels, rats, and mice through exposure to body fluids or by touching or handling live or dead animals. Sexual contact. Mpox can be transmitted through sexual contact and was the primary route of transmission during the 2022 outbreak. These are important differences There are important differences between airborne transmission and transmission via respiratory secretions. Airborne transmission occurs when small virus particles become suspended in the air and can stay there for periods of time. These particles can spread on air currents or sometimes even infect people who enter a room after the infected person has left. In contrast, monkeypox may be found in droplets like saliva or respiratory secretions that drop out of the air quickly. Long-range transmission of monkeypox has not yet been reported. Here's a small visual to get a better understanding of the different outbreaks of monkeypox from 2017 to 2022. In 1970, the first patient of human monkeypox was diagnosed in the DRC. After that, more than 400 monkeypox patients were documented in Africa between 1970 and 1990. The vast majority were diagnosed at DRC, followed by 6 cases in Central African Republic, 2 cases in Cameroon, 3 cases in Nigeria, 2 cases in Ivory Coast, 4 cases in Liberia, and 1 case each in Sierra Leone and Gabon. In 1990, there have been 4 cases of suspected monkeypox in Cameroon, one of which has been unconfirmed. In 1996, the DRC experienced a prolonged outbreak of human monkeypox. Initially, a patient was confirmed in February of 1996, and until August of that year, a total of 71 suspected monkeypox cases were reported. As of 1999, over 500 patients of monkeypox were reported in the DRC. From February to August 2001, a total of 16 cases of monkeypox were identified in the province of Equator in the DRC. Meanwhile, a study conducted by Anne in the DRC from 2001 and 2004 examined vesical fluids and crusted scabs from 136 people suspected of having monkeypox. They found 51 patients of monkeypox. Human monkeypox attracted little attention worldwide until the first outbreak occurred outside of Africa in the United States in 2003. 47 cases with confirmed 37 patients and suspected 10 patients of monkeypox were reported, and all people infected by contact with pet prairie dogs. The pets were infected by after getting in close proximity to imported small mammals from Ghana. According to CDC, laboratory tests using virus isolation and PCR amplification have proved that at least 3 dormice, 2 rope squirrels, and 1 Gambian giant rat were found to be infected by monkeypox. It was noted that no deaths occurred and no human-to-human transmission was observed, which was explained by the strain being a West African strain, based on genetic analysis performed afterwards. In addition, a study was conducted to evaluate the effects of the route of infection on the clinical illness of human monkeypox and demonstrated that significant symptoms of systematic diseases were more likely to occur in cases exposed to complex exposures than in cases exposed to non-invasive exposures, in contrast to Africa. A large number of cases confirmed in this outbreak are adults. Thousands of people around the world have been infected by the monkeypox outbreak in 2022, which followed several years of sporadic cases outside of Africa. The recent Mpox outbreak caused by subclade 2B has caused more than 100,000 cases in 122 countries. 115 of those 122 countries had never seen monkeypox case before. Most susceptible to monkeypox are the men who have sex with men, and in 2022 and 2023 outbreak, it was largely reported that MSM, and they may be at higher risk due to close physical contact. People with multiple or new sexual partners are also at higher risk. People that have HIV, those that with unmanaged or newly diagnosed HIV infections are also at high risk, and pregnant people may be at risk because they may be able to pass the virus to the fetus through the placenta. Children may be at high risk, mostly children under 8 years old. Majority of the cases reported are men aged 18 to 44, although this does not mean that other age groups cannot be affected as well. Almost everyone has been affected by monkeypox. Here are the continents that have had cases. It was mostly found in Africa, Europe, the Americas, and Asia. The culture and diagnosis. First, healthcare professionals start by examining the rash. Mpox is diagnosed using polymerase chain reaction, which is a PCR test that you might be familiar with from the COVID-19 pandemic. The samples are taken from lesions or sores. Healthcare professionals might also collect a blood sample to test it for antibodies, and the results are usually available within 2 to 4 days. Healthcare professionals collect 2 swabs from each lesion. Generally, they collect it from 2 or 3 lesions or so, in case there's any additional testing, such as clade-specific testing, that may be needed for those patients in the future. And for prevention, the most important thing is getting vaccinated. You also want to avoid close contact with people that have rashes that resemble Mpox, avoiding animals that may carry Mpox. If you're living or caring for someone with Mpox, limit the contact with their objects, such as clothing, personal items, phones, etc., and sharing spaces that they were in. Wearing a mask and practicing social distancing, eating cooked food, washing and sanitizing your hands as frequently as possible, especially if you've had any contact with an infected person. Typically, if soap and water is not available, we would want to make sure that we use an alcohol-based hand sanitizer that contains at least 60% alcohol. There's currently no treatment for Mpox, but there are certain medications that have been used to treat the symptoms of Mpox that the patients have had. Most importantly, it is always recommended to start with self-care. Staying at home in a very well-ventilated room, washing your hands often with soap and water, and using hand sanitizer, as previously mentioned. Anything with 60% alcohol or above, wearing a mask and covering lesions when around other people, keeping your skin dry and uncovered to let the lesions breathe, avoiding touching any shared items or spaces, disinfecting shared spaces very frequently, rinsing the sores in the mouth with salt water, taking warm baths with baking soda or Epsom salt for the body sores, and also taking over-the-counter medications for pain like paracetamol, Tylenol, or ibuprofen. And the antiviral drugs that most commonly are used for treating Mpox infection are tecovirimat, cidofovir, bencedivir, Vicinia immunoglobulin, and trifluridine. And here's the works cited. Thank you so much.